Hello everyone, Dr. Chappius here. I wanted to inform you all about a very common problem that many people refer to as pink eye. The proper name is conjunctivitis. Conjunctivitis is when the conjunctiva is inflamed. But what is the conjunctiva? The conjunctiva is the clear tissue that overlies the white part of our eyes. There are many reasons that this area can become inflamed or irritated, but we can break it down into three main causes. The first main cause would be allergy. In an allergic conjunctivitis, our eyes are typically red, watery, and itchy. Itchiness being the key symptom there. We can avoid this type by avoiding our allergens, but that's easier said than done in most cases. We treat an allergic conjunctivitis with an allergy eye drop, many options over the counter. Sometimes you will need a prescription, and sometimes you will also benefit from an oral allergy medication like a Zyrtec or a Claritin, for example. So if you have this type, typically easily treated and not contagious. So that's the good news there. The second main cause would be viral. Now in a viral conjunctivitis, it can look very similar to an allergic conjunctivitis, but it is very different. With the viral conjunctivitis, it's going to be very contagious. And so as long as you're actively tearing or red, you can assume that you're contagious. Unfortunately, no specific treatment. We have to let the virus run its course. And, you may have some other symptoms associated with this, like a runny nose, a sore throat, a headache. And so all I could really recommend is a cool compress to help that inflammation and the burning sensation that you may have in a viral conjunctivitis. The third main cause is bacteria. So that's probably the main thing people think of when they start to get irritation of their eyes or they think they have pink eye. They're concerned about a bacterial infection. And so with a bacterial conjunctivitis, again, you're going to have the red eyes and discharge, but typically the discharge is a little bit thicker, a little bit more mucousy. Sometimes there's exceptions, right? Sometimes no discharge at all or very little discharge. But with a bacterial conjunctivitis, we can treat that with an antibiotic eye drop. And typically that will make you feel better pretty quick. And again, contagious, so we have to avoid sharing things that may touch our eyes or our face. So this goes for viral or bacterial. Avoid sharing pillowcases, sharing towels, washcloths, anything like that that comes close to the eyes. You should be trying to just avoid touching your eyes in general. But if you do have to touch them, wash your hands immediately after. Wash your hands frequently anyways during this time. And, you really want to try not to give it to anyone else. You may be more prone to this type if you're a child or you wear contacts. If you wear contacts, always remove them if your eyes start to get irritated and avoid wearing them while you're symptomatic. When you get back into the contacts, once you're feeling better, always start with a fresh pair. Bottom line is, if you have redness of your eyes or you think you have a pink eye, contact us so we can provide an examination of your eyes. That's very important so you can get the proper treatment right away. Here at South Jersey Eye Associates, of course, we can diagnose and treat any type of conjunctivitis. So let us know if you're having these symptoms and we'd be happy to help you. Take care.